Good evening, dear students. So now in the second part of the class, we will be discussing about the management of hypertension. First of all, before managing the hypertension, know your targets. What is your target for management of hypertension? In case of old age patients, we are a bit little relaxed about the blood pressure targets. So if the patient's age is less than 80 years, the target is less than 140 over 90 millimeter of mercury. Okay. And if the age is more than 80 years, the target is less than 150 over 90 millimeter of mercury. Because our old age patients, a lot of complications they may have, such as postural hypertension, that will increase their risk of frequent fall. So we are a bit relaxed about the blood pressure targets in old age patients. If the patient has any other comorbidities such as diabetes or patient has proteinuria or renal complications, what is the target? The target is 110 over 70 millimeter of mercury. That is a bit lower than other conditions. Okay. So before managing the blood pressure, we have two approaches for management. One is lifestyle modification. There is a core management of any type of illness. And second one is pharmacological management. So what is the blood pressure management? If the patient is overweight, you have to ask the patient to reduce the body weight. The ideal body weight management reduction, that is, we have to ask the patient to take at least 30 minutes regular aerobic exercise 5 days in a week. That is 150 minutes of exercise in a week. Weight reduction, patient should take Mediterranean style diet. What is Mediterranean style diet? There is region patient will be taking a lot of vegetables, but patient will not take any saturated fat. Okay, and rich in seafood and vitamins. Okay. Then if the patient is a smoker, patient has to quit smoking. If the patient is alcoholic, patient has to moderate the alcohol consumption. And if the patient has any other alcohol related complications, then the patient may quit the alcohol permanently. Okay. So after all this lifestyle modification, weight reduction, doing regular physical activities, salt restriction, not taking any drugs that can cause increased blood pressure such as steroids, excessive salt intake, the NSAIDs. Okay, then we'll go for the pharmacological management. The drug or pharmacological management. If the patient's age is less than 55, that is patient is a bit younger, we always start with the ACE inhibitor or ARBs. But if the patient is more than 55 years old, that is a bit elderly, or the patient is originally from the black ethnic background, then calcium channel blocker has been found to work better. So starting approach, if the patient is less than 55 years old or has any other complications such as diabetes, chronic kidney disease or heart failure, any of these comorbidities, we have to start with the ACE inhibitor or ARBs, that is A. If no other such conditions present, the patient is elderly more than 55 years or the patient is black ethnic origin, starting with the calcium channel blocker. Okay, first step. Now the blood pressure is not controlled. In the stage 2, we will combine both of them, or ACE inhibitor ARBs with calcium channel blocker. Still blood pressure not controlled. Then the step 3, ACE inhibitor ARB, calcium channel blocker, and there will be a D drug added. This D drug is either thiazide or thiazide-like diuretics. Okay. Now A, C, D done. But still blood pressure is not controlled. At this stage, we call this resistant hypertension, when the blood pressure is not controlled even with 3 drugs. So at this stage, always confirm if there is any secondary cause of hypertension present, if the patient is regularly taking his medications or not. Then still blood pressure not controlled, go for a 4th drug. This 4th drug is spironolactone. There is a mineralocorticoid receptor antagonist. Before starting spironolactone, it has a major side effect or risking hyperkalemia. So look for the baseline potassium ion level. It is advised if the patient's potassium ion level is already a bit higher, that is more than 4.5, be cautious before starting the spironolactone. 4 drugs given, A, C, D, and spironolactone done. Still blood pressure is not controlled. Then we add another drug, this is alpha or beta blocker. This alpha or beta blocker is not that much effective in controlling blood pressure, but when we have tried all this, we will go for it. And also side by side we will look if there is any secondary causes present. For example, this patient has pheochromocytoma, or this patient has aldosterone mechanism problem. So no matter how many drugs you give to the patient will not improve unless you are surgically removing the tumor. Okay, so moderation of blood pressure control and surgical removal would be the treatment in these patients. Okay, and this hypertensive patient, is it necessary this patient will only have hypertension? So we'll search if this patient is diabetic, optimal control of diabetes is needed. If the patient has dyslipidemia, control of dyslipidemic status with a lipid lowering agent is needed. And we'll also assess the patient based on family history, his own risk by quick risk, Q risk assessment. That is, patient is at how much risk of developing cardiovascular disease in next 10 years profile. Okay, if this patient is at high risk of developing any cardiovascular disease in next 5 or 10 years, we'll start another agent, that is aspirin, low dose aspirin before an event, as a primary prevention drug to reduce his cardiovascular risk factors. So this is the management of hypertension. And what is our target? Know our targets. This is the management of hypertension in normal setting, but not the management of acute hypertensive urgency or crisis or emergency. We will discuss about it in our next video. Thank you.